Are you a female? Are you in your 30s? Do you experience clicking and popping of your jaw? You might have TMD. Who is at risk? I'm Dr. Olga Dolghier here at Palm Valley Pediatric Dentistry. I'm a board-certified pediatric dentist and laser dentist. So let's talk about TMD. What is TMD and what is TMJ? Those are common things you hear on media. So TMD, temporomandibular disorder. It's actually a disorder of your joint. So like your elbow, we have joint, and we have the same type of joint in your jaw. So that's where TMJ is. TMD is actually a disorder when that joint does not work properly. So who is at risk? Surprisingly, in primary teeth, some kids, according to new study, have about 34% discomfort, pain related to temporomandibular disorder. Adolescents show only 11%. But when you becoming an adult, 84% of females suffering from this problem. So what causing this big issue? Number one, trauma and different type of accidents. Car accident, for example, major life-changing accidents. Micro trauma, for example, nail biting, surprisingly can cause TMD disorder. Overworking your joint, chewing gums for long period of time, crunching really hard can actually hurt your TMJ. Also, anatomical structure. If you have extremely crowded mouth, if your jaw is forward, we call it class 3 malocclusion, they are more prone to develop this disease. Also, we hear about stress. Our life is full of stress, and how we manage stress reflects on TMD. So if you have crunching your teeth, bruxism, constantly kind of holding back and stressing out, not showing your emotions, then your jaw feels that. Kids who are stressed, you can see flat surfaces. Sometimes competitive sports, surprisingly in children. We had a case when a little girl came 6 months checkup. Now look at her teeth, and her teeth were flat. I said, what happened within the past 6 months? She actually was in competitive dancing. It was so stressful for her that she literally grinded her teeth to a next level, to dentin. When we see grinding and bruxism signs, we have to be careful how to diagnose. Because a lot of times wear on the teeth can be a representation of gastrointestinal problem when you have high acidity in the mouth. So it's all interrelated, and you have to be careful and diagnose right. So what are the tools for diagnosis? First of all, your dentist probably gonna do a simple physical exam. They will touch your joint, and surprisingly, sometimes certain muscles feel very tender, painful on palpation when we just ask you to open and close. Also, we hear the noise. Jaw will pop and click on one side and don't make any noise on the other side. Then after a while, the clicking sound goes away and we think we're better. So that little disc in between your joint actually go up and down. When you hear clicking, it means that it slides out and then forcefully pulls back, and you hear pop. With time, the popping sound disappears. It doesn't mean that your condition, temporomandibular disorder, is resolved. It means that the disc actually permanently stuck, cannot go back. We call it disc displacement without reduction. So what can we do? Diagnostic tools also are our X-rays. On simple panoramic X-ray, we can see some changes in your joint. There is a specialty of dentists who are specializing in pain and temporomandibular disorder, who would do CT scan, actually arthroscopy, because some systemic diseases, your arthritis, can present in your joint. And this is other joint of your body. If you don't consider or don't think about it, this actually can be your arthritis there. Also, what can cause TMJ is predisposition genetically. We actually did big study and found a couple of genes which, if you carry on, they serve protective from TMJ disorder. So those people don't get TMJ as much. What about hormones? Because I mentioned female. Actually, 84% is females at the age of 33 when they present with pain. So we thought about estrogen. So the big studies, a randomized control study, actually showed no role of estrogen in TMJ disorders. But cohort studies means that certain population who reports that points to females. So we're still learning about this disorder. We don't know for sure what's causing it, but those are the main factors which can contribute. So what can you do? Number one, a lot of times you grind your teeth, you're destroying your joint because of stress. So stress management is extremely important. Maybe talk to your physician, maybe you'll need certain medication, maybe you need meditation and yoga to relax yourself, take care of yourself. That's number one, to reduce your stress. If your kid is in competitive sports, maybe we should push them, but not as much that they destroy their joint. Also, different methods like physical therapy, actually different massages, acupuncture. You have to find the right provider who can provide this for you. Also medication. Sometimes if I see a young girl who is in her puberty, adolescence, who just going through this hormonal changes and all of a sudden very painful joint, we put them in simple anti-inflammatory medications like your ibuprofen, and we keep them until that inflammation goes down. We advise not to overwork your joint for that period of time. And a lot of times they do get better. When you're an adult and you still grind your teeth unintentionally, then we can make a special night guard. Night guard is a big plastic guard, stays in your mouth through the night, and instead of destroying your own teeth, you're actually grinding on that plastic. Also, TMJ disorder can present something bigger. Like I mentioned, arthritis. We're also now thinking about airway obstruction. So a lot of times grinding relate to airway obstruction, not breathing properly during nighttime. So it's all interrelated, and as I said, your oral health, it is a part of your overall health. So proper evaluation, proper management, diagnosing is critical for this disorder. So we don't want to ignore it and say, okay, it's just gonna go away. Sometimes it does, sometimes it needs deeper interrogation and finding out what exactly causing the problem for that particular patient, for that particular child, especially if it's a girl. Boys, same way, of course. I want you to share with me if you ever had clicking on popping of your joint, and what did you do, what kind of recommendations you had, and are you struggling with this? Share below and let me know if you like this type of videos that I can make more. Thank you for watching. I can't wait to see you soon.